80% of the women who walk into my clinic are coming in with some signs and symptoms that reflect hormonal changes. Most of the time, it turns out to be PCOS. Hi, I'm Dr. Anindita Sarkar, MBBS and an aesthetic physician, and practicing for over 18 years. So most of these young women are accompanied by their parents who are obviously very concerned about it, and the first thing that they tell you is, Dr. Saab, हम जब छोटे थे इनकी एज के थे तो हमारे कोई ऐसे एक्ने नहीं होते थे या इतनी प्रॉब्लम्स नहीं होती थी, ये शायद जंक फूड खाते हैं, ठीक से सोते नहीं है, रात भर टीवी या मोबाइल पे रहते हैं, इसलिए होता है. Well, there is some truth to it. But beyond that, let us understand what is PCOS. So PCOS is a group of symptoms, and not everybody will manifest the same set of symptoms. Some could be, the whole set could be about 19 or 20 symptoms, but you could have people walking in with 1 or 2 or 3 or 4, in more severe cases, more than that. And that's how we grade them to be mild or moderate or severe cases of PCOS. So the common symptoms that you might notice are facial hair growth, dark patches on the underarms, nape of neck, under the breasts and groin, and sometimes skin tags, and of course, excessive body hair as well. So to not put all the blame on PCOS, the full form is Polycystic Ovarian Condition, sometimes these changes can also come from the adrenal glands or from the brain, the pituitary gland. But the symptoms are the same and they are managed in exactly the same way. So when I get clients through clinically video consults, I sometimes order these tests to confirm whether the hormonal changes are arising out of the ovaries or the adrenal glands or the pituitary, just to make sure that my labeling is correct. Irrespective of the origin of the hormonal changes, the management of the condition remains the same. However, if the blood parameters throw up unusually high number of markers, then that definitely has to be treated medically. However, if the blood parameters come out grossly impaired, we might need additional medical management. So it has been seen that lifestyle changes and dietary management improve the conditions a lot. So you have to keep your weight as close to your target weight as possible. So there has to be some kind of a dedicated physical activity that one is doing. And in dietary balances, one must cut out on the useless carbs and the dairy. And now we come to the symptomatic management. Maintain a diet which is rich in protein. You can use peptide serums on the scalp to fortify the follicles and to strengthen the hair shafts. Have a hair complex vitamin every day for about 2 to 3 months so that your hair stays longer in the growing phase. For the acne, it is important to use maybe a salicylic-based face wash which clears out your dead skin, unclogs the pores, reduces your comedones. Use a mild moisturizer which is non-comedogenic, and you must use a sunblock. If you have active acne, you can use benzoyl peroxide creams at night topically. For the facial hair or for the body hair, you would have to visit a clinic maybe for laser hair reduction. The acanthosis or the dark patches on the underarms and the nape of neck can be treated with skin lightening creams containing tranexamic acid and other skin lightening agents. And for the skin tags, again, you will have to visit a doctor to probably cauterize them. So PCOS is a medical condition. And I would highly recommend that please do not try and treat it at your own end. Do consult a doctor because everybody presents with a different set of symptoms and your treatment protocol has to be managed differently. So get your tests done, see your doctor, and at clinically, we offer video consults for as low as 250 rupees. So it is a worthwhile decision. It might be just worthwhile for you to get into a video consult with a clinically doctor and get your own set of customized products and lifestyle management.